Here we go. Um, I hope that more people, I know a lot of people RSVP'd to come to this or told me that they were coming, so they might be filtering in a little bit late or relying on the recording. But we're going to go ahead and get started because I want to honor everybody's time. And it is such a treat that we have Dr. Anjali Noble with us today. We're going to be talking about the crossover between Cirs and multiple chemical sensitivity and breast implant illness. There are a lot of people in all three of these camps, I guess I should say in each of these camps. And there are a lot of people who are in all of it. And we're going to kind of talk about like the difference between these three conditions and the crossover and how to figure out kind of what's what and unravel the toxicity. We'll let Angelina guide us through that with some questions that I'll ask. But first I'm gonna read a bit of Anjali's bio. You guys know that I like to do this just so we can fully appreciate her background and her area of expertise in this. Oh, good. Here comes Jenny. We'll let her in. So Dr. Anjali Noble is board certified in internal medicine as well as integrative and holistic medicine. She completed her fellowship in anti-aging, regenerative, and functional medicine in 2009. She is a board examiner for the American Academy of Anti-Aging and is a fellow in metabolic and nutritional medicine. Along with all of her accolades, she's also a certified member of the Institute for Functional Medicine, American College for Advancement in Medicine, and the International Peptide Society. In addition, she is certified under Dr. Richie Shoemaker to help people suffering from exposure to mold and other biotoxins. She's an active member of both the Surviving Mold and ICI professional communities. Dr. Noble has been a professor of medicine at Nova Southeastern's College of Osteopathic Medicine and enjoys educating and empowering people to see the benefits and success stories of functional medicine. She's very passionate about her field and strives to be a role model for her patients through practicing what she preaches. Dr. Noble enjoys an active and healthy lifestyle, which includes healthy eating, taking high quality supplements, strength and cardio training, yoga, and being a wife and mother to 3 beautiful children. Anjali, welcome. And what an amazing background that you bring to the table. Before we continue going, you guys, I have a cat who is elderly and not always continent, and he wants to get out of the room. So I'm going to let him out. I'll be right back.
Okay.
So welcome, Anjali. We're so glad to have you here. And I am going to invite you to share a little bit more about how you got into the Shoemaker world, the world of mold and chemical sensitivity and breast implant illness. Some of us get into this because of personal experience. For some, it's family members or friends who've gone through this. For some, it's just, patients keep bringing these things to the table, and it requires an open mind as a clinician to dive into this. And we'll let you share a little bit about that. But first of all, just to introduce you to the Cirs Healing Collective, we are aspiring Cirs overcomers from around the world. There are about 350 of us in the collective. And as I mentioned, a lot of them couldn't come today, but are going to be listening to the recording that we put in the library. But most of us, I would say 90% of us are following the Shoemaker protocol. There are some of us who are following, maybe working with a doctor, of a different persuasion, but we are all here not to identify as victims, but to be empowered with hope and pro tips for getting through this and reclaiming our wellness. So that's who we are, and welcome.
Well, I'm happy to be here. So
You're here.
Super passionate about biotoxin illness and helping people that have, environmentally acquired illnesses. And, when I first started out practicing, I practiced traditional medicine. I was professor of medicine at Nova for about 10 years. And then I had hormonal issues. And I got into functional medicine because nobody knew how to treat these issues. They were just throwing Prozac and the birth control pill at every woman that said that she had issues. I mean, that's what was going on back then. And luckily, Suzanne Summers was trying to bring light to some of this information. So I studied under Uzi Reese, which was the doctor that had treated her. And I instituted some of the guidelines, got 99% better, and then I had shifted my whole practice into digging into this field and really wanting to get people better and not just doctoring with pharmaceuticals and things like that, and trying to get to the root cause of what created this in me.
Yeah.
So in about 10 years, fast forward another 10 years. So I've been doing integrated medicine now for over 20. And then fast forward 10 years, was all about the hormones, but you really can't function, and properly fix your hormones without understanding chronic inflammatory response syndrome. And it's not usually one thing that creates this problem. If you see, now that I've been practicing for so long and have seen a pattern, many patients have, just like I did, dysregulation of their stress. We call it the HPA axis, which is really the brain adrenal um, access. And I had grief. My mother-in-law had passed. She was our everything for our whole family. It was kind of sudden, and we were all in disarray. And a lot of my symptoms I tried to attribute to the grief.
Mm-hmm.
And then one afternoon, my son came in our room and he's like, "Oh my God, it just smells in here." And we had a really bad water leak and just was ignoring it because we were all hurting so much. But that dysregulation was really my trigger of the immune system to kind of react to everything. Because I had all of the symptoms. I had so many of the symptoms that are many of you probably have because you're dealing with Cirs. The inner trembling was really severe. And, as time went on, it took a long time to figure out how to heal. And then I had studied with, Dr. Shoemaker and all of the mold warriors that we have together and joined the community. And I was able to institute the program and finally get better. In my integrative medicine training, it was incorrect in how to treat this situation. And
Interesting.
it really, really was. And I had gotten better. I was out of exposure. I had instituted the program, and majority of my symptoms had gotten better. However, I had three lingering symptoms that just weren't 100%. I would say my brain went from being completely in a fog to about 30% in a fog. Could run fast again, but I couldn't run long still. And I had severe anxiety and I was waking up with panic attacks and things like that. So I decided to redo the genie and see what's happening there. And you could see, I don't know if everybody's familiar with the genie, but
I think so. Yeah.
yeah,
At
yeah.
least in this room right here. Yeah.
Okay. So I looked at the genes and I wasn't reacting to mold anymore, right? It had cleared. My genie looked much improved.
Wow.
So I realized there's something more going on here. And I didn't have true chemical sensitivity, but after having my third baby and seeing the changes in my body, I had put implants in. At the same time, I started on this journey of functional medicine. And I
Mhm.
think, for the 10 years prior, I was doing okay. But then you put the grief in there, you put the mold in there, then you're sensitive, even more sensitive to these chemicals that we put into our bodies. I mean, if you really think about it, it makes sense. Like you're putting something in your body that has 37 chemicals, but they had just reapproved them. And I just being young and you doing what you think is the right thing to make yourself feel better. I did it. And then
Um,
literally 3 weeks after explanting, I was 100% better and probably better than before I got even sick. Like you don't realize that you're struggling until you're not.
wow. What a story.
Yeah.
Interesting, Anjali.
Within 3 weeks, the light bulb went on. I was like, oh my God. It's almost, I tell my patients, it's like having a cerumen impaction and people, everything's muffled. And then all of a sudden you get an ear lavage and you could hear and you're like, oh my God, that's how you're supposed to hear. That's what happened to my brain. It was just like in this like awful fog. And there are so many women that are struggling with this because in that era, everybody, you call it the Pamela Anderson era, everybody was thinking it was fine. They approved it again. It's fine. They don't even talk to you about the risks or
Right.
it was really a sad situation. And there are many, many people now that after they were approved are struggling. But I believe that many of them, and in my experience with my patients, many of them actually have been triggered from mold and Lyme and making them more chemically sensitive. And then now they're reacting to their implants. And after COVID, it all went up even more because again, remember, the immune system is dysregulating. So,
Right.
it's all a similar process. And I've been collecting data on all of my patients. So it's really, hopefully, eventually I will publish, but we'll see about the whole
Oh,
stuff.
I'm fascinated by that, and I'm going to be asking you some questions about that. Thank you for sharing your personal journey with this. I think that when clinicians have a their own experience with these things, they can treat their patients with so much more understanding and compassion because they've been there. And thank you for your vulnerability, sharing, the different things that you went through and what you learned. Even as a doctor, like we all do the best with what we know at the time,
Right.
and you were doing that and it failed you. And then that forced you to look further, find the Shoemaker protocol, find out more information about breast implants, and we learn as we go, and then we can go back and help other people. And that's what you're doing in your practice now, is applying all that you learned the hard way to help other people maybe have a shorter path to wellness, right?
Yeah. And I don't believe anything's by coincidence. So I do feel it was all a blessing because, like I said, I'm 100% better. You know what I mean? So you can heal from this. So it's so exciting. But the hard part is finding somebody that could actually say it's this, or this, or
Um,
it's all three. I always say it's a stacking effect. Like we're not isolated. Like the same thing with general medicine and how we shifted to functional medicine. General medicine is a disease model, right? We're looking at a disease model. Functional medicine, we're looking at a wellness model, but we also can't look at it isolated.
no,
It takes many different things to set the body off. So
no,
I mean, I can't even explain how many times everybody's triggered with some kind of trauma. There's something happened, then all of a sudden they're down this chronic inflammatory response pathway. So, people in our field and that are trying to do this holistic type of stuff need to understand that too, you know.
right. So you brought up some really interesting things and things that I'm so glad that you, as a physician, are willing to say are important. One being the nervous system or stressors. You brought up grief in your own journey. And there are
Mhm.
a lot of doctors who'll be like, whatever, that's just kind of like an emotional experience. That's not like a medical condition. But we know so much more now, or at least a lot of clinicians do, including yourself, that that can be a trigger or an instigator when our nervous system gets triggered by something and is not properly regulated. That we basically, that talks with our immune system, and then we are more sensitive to things that we may have been tolerating before, like the chemicals in our environment, or maybe the implants that we already had, maybe even the mold that we had already been living in. We were tolerating it before when our body was kind of holding it all together and we weren't triggered. But boom, you get COVID, or you go through some kind of trauma like a loss of a loved one, and
Mhm.
house of cards begins to fall. So when you have clients, let's say, who have all three, they feel like they have chemical sensitivity, like they react to fragrances and chemicals, maybe even foods. They do have breast implants, and they've been diagnosed with Cirs, and they're in mold exposure. How do you unravel like what came first? Like, do you have to get the breast implants out first and then clean the home, or like what's the order of events that usually
All
happen?
right. So I literally spend 2 hours with my new patients. I go through their whole history of what created all this. And boy, do we have a very, there are so many people that have, childhood adverse events and trauma in their lives. And, everybody's been triggered, and COVID just exacerbated all of it because we all went into this like fight or flight response and everything like that. So when it comes to mold, usually a biotoxin makes triggers the final response for you to start being sensitive to everything. And what I have found, because now I have treated a lot of these patients, if you don't, you have to start, doing like vagals. You talked about this, I think, in one of your things, maybe I think I saw it on Facebook, that you spoke about the limbic system and vagal nerve, stimulation. And you also have to look at mast cells activation too, because mast cells start taking over many times when our immune system is dysregulated and our regular, cellular immunity is not working. We tend to, the mast cells come jumping in, and they're indiscriminate. They're here to help you survive. So they just start creating, more oxidative stress, more, mitochondrial issues, more inflammation, and it's just a vicious cycle. So you got to kind of calm all that down. So you got to look for that. You got to calm that down. And that's intertwined in the whole situation. But if you don't get the mold out before you explant, you're stuck. I can't tell you the amount of patients that I find stuck until they've calmed down their immune system from the biotoxin. Then they explant, then they get better. If they do it in the other order, I don't it takes so much longer.
I
And
would imagine that having surgery, going under general anesthesia, a significant surgery, and then
Mhm.
coming home to recover in mold exposure, that's not
Correct.
going to go very well. Is that kind of why you see that like we need to clean up our environment and then put our body through that temporary stress to relieve the burden, right? And that's
Correct.
going to be a smoother path.
100%. So, I just do feel the only patients that I find that get stuck are the ones that explanted first. And then they're just caught in the moldy environment, like you said. Because I mean, just think about it. You've got HPA access, or this like adrenal fatigue, that is not a proper term, but it's the same principle. The brain stops being able to respond to the threat, really, and the cortisols just do whatever they want until they can't be produced anymore to create that fight or flight. That's when you get depressed, you get even more mast cell problems. So, a lot of these patients, you have to dampen that first. And where was I going with this? Explain. I was like, what was your question?
Third grade. I think we were just talking about the order, and you were talking about kind of calming stress, cleaning up
Yes,
the environment from
yes,
mold before
yes.
planting usually
Right.
goes well, kind of like
Oh,
bringing
right.
calm to the system.
No, so I was telling you, so that HPA access with surgery, that's where I was going with this, is huge.
Yeah.
Surgery is one of the things, surgeries, infections, all that. That's another hit to the HPA access, or, your fight or flight response
Right.
system. And you're even farther behind again, because you've got to start correcting all of that. I mean, to me, it just seems like common sense, but maybe that's just because I've been practicing medicine so long, so it's common sense to me. And you think about it, and like we're paying so much attention to, we're not going to microwave our food, we're not going to use microplastics, we're not going to, do all these things. We're trying to live that, which is awesome because it's the toxic load that your body eventually can't handle, right? I mean, it just, how much can you pile on into the system before it dysregulates and creates an issue, right? So you think about it, and these poor young girls are just not being well informed, and they're starting out with a toxic load of their body processing all of the toxins in implants. There's 37 toxins in implants, 18 are heavy metals. And a lot of them are, same as the volatile organic compounds that we talk about. You got benzene, you got all these weird chemicals, even in saline implants, it's in the shell. So, what I found is when I did the genie in many of these patients, they all had chemical sensitivity activated.
And what
Mm.
showed that on the genie? What specifically would somebody
It's,
look for?
so you would look for the VIP receptor with the Icarus receptor. So if the Icarus receptor is high and the VIP is negative, you have chemical sensitivity. If it's switched, it's a brain issue. So that's where you look at that. So I would say 80% of the samples that I took had chemical sensitivity. And those
And
are
these
the
are
people that,
women who were Cirs patients and also had breast implants. They had
yes,
signs of
yeah,
chemical sensitivity. And
yes.
so we're assuming that's from their breast implants. How do we know it's not because, let's say, they're like living in new construction and there's a lot of VOCs? Could it be that too? Or,
It 100% could. You have to, you know, you have to research that, and you got to
Okay.
dig in that hour or 2 hours.
Wow.
Yeah, you gotta dig. And they fill out so many forms. They're kind of like, I'm done talking about all of this, because what ends up happening when your immune system is upregulated and shifted, where we don't have that shut off mechanism, you end up getting a decreased tolerance to everything. So when you could tolerate this amount of mold and toxins and all of a sudden you can't tolerate 5% of them. So you just become so sensitive to everything. And those patients, I mean, I'll be honest, I haven't had probably a handful of those kind of patients that can't tolerate anything. It's a scary situation, and it takes years to help them.
Yeah.
Luckily, I've only seen probably a handful of all of the patients that get that bad, you know.
And then would your treatment of those super sensitive patients include trying to get rid of the toxic burden, whether that's cleaning up their house, then maybe explant if that's part, getting rid of VOCs in their house and calming their immune system, mast cells, working on the nervous system, kind of just all of it and helping them bring their
Yes.
calm self into increased capacity to live in the world.
Yeah, and it's really hard to do that when you're told, oh, you got to move and you got to find a place to live with your 5 dogs, and you got to, you know what I mean? That doesn't have mold too, and isn't, so
Doesn't
you're
have
like,
VOCs and doesn't have mold, right?
I
Yeah.
mean, and then you tell them, calm down, they're living in a state of fight or flight. And it's just everything is a perceived threat. And it takes a while to get there. Like when I was like going through this whole process, I literally would just see like a bubble or water damage, and that whole fight or flight would just start. My family too. They were just so nervous about the whole thing because I was so, I was the most affected given my toxic load. It only makes sense.
Yeah.
Forget the genetic part of it, because we do have the genetic HLA that has problems with detoxifying,
Right.
right? So do all biotoxin multi-susceptible people all have chemical sensitivity
That was
potential?
a question that I had. Yeah. So is there like a gene for, increased susceptibility to chemical sensitivity? Any of the haplotypes that you see more
You know,
likely to?
to be honest, they all have the HLA to be Cirs vulnerable, every single one. I've yet to see any difference. And also, even my my patients that have implants that don't have Cirs, I do a screening VCS on everybody. I just do, right? And the symptoms, because I live in Florida. I mean, it's like mold country, mold state. So they all fail.
So that would indicate or suggest maybe that
Hmm.
somebody could be hunky-dory, living in mold and maybe fine. They go and have the surgery, get implants. Time goes by, maybe there's some additional stressors or who knows what, but they
Hmm.
get sick. They come to you and they feel like they're just sick from their implants, but it turns out they also have Cirs.
Correct. And the problem is, I see all these people talking about, toxic implants and, the toxic truth and all of these things. And I just get so frustrated because they're missing why these women are still sick. And being a doctor, like, I don't want to get on these like chats and start like I'm a doctor, like I can't do that. You know what I mean? But I know a lot of people do, but I feel like that's just, if you don't ask, don't tell, kind of, you know what I mean? But the reason why I feel that they're still sick is because they are dealing with this and they don't even realize it. So those are the ones, because usually 81%, so there was just a new study out in 2025, 81% of to 82% of people that explant immediately better within 3 weeks. They're better, like I was. But then there are the other 25% that are stuck. Why are they stuck? But they're not getting it. They're not understanding it because we got to talk about it more. Could
Okay.
they're probably dealing with mold and Lyme and they have chronic inflammatory response. And the markers or the Cirs markers. I had a patient. I did a documentary called Under My Implants as the expert, which I ended up being one of the people too. It was
Wow.
never intended to be that, but it ended up being that as well. So there were 5 women that spoke about their experience, and I followed one as her expert through the whole process. She was really young, and they had put in these textured implants, which now have been recalled. So this was
Wow.
like 5 years ago. They now have been recalled because they cause lymphoma, breast implant associated lymphoma. And, 1 in 1,000 to 3 in 1,000 people get this lymphoma. So you're a breast cancer patient and you're putting in an implant because, you want to feel whole. It's a whole nother topic, right? And
Oh,
then you have another risk of cancer for more cancer, for cancer. So it's like it's very complicated, but I followed her through her thing and we did the Cirs stuff. We did all the Cirs markers. We did the VCS and she's young. So, it's cumulative as we get older and older of all of our exposures as we go along, right? Everything normalized after the explant. With
wow.
the
So
repeat,
she
the
had
next,
positive SIRS labs, and
yes,
those regulated with just the implant.
with
Was
the
there
explant.
mold in her implants, or was it just chemicals?
It's hard to tell, when you talk about mold in the implants, there, so there is a biofilm situation that occurs because what happens is when you get implants, the body says, oh, I see something foreign. The immune system goes in and it builds scar tissue around the implant because it's trying to protect you. It's saying, oh my God, there's something here. I've got to protect my body, and there's a gap between the implant and the scar tissue, usually. And in that gap, you get biofilm and you get bacteria. Well, what do you think is the number one bacteria in that gap?
Probably actinos or endos.
It is in the family of actinos.
All right.
Yes, it is in the family of actinos. And as your community is probably known because you're so, well experienced and everything, 47% of us that have Cirs, it's actino. And I had actino. So could you imagine, my exposure was actinobacter, right? So you can imagine I had it in my implants, in my body. Like it was, of course I was going to be that sick.
So somebody who is positive for SIRS and they do a genie and they also have implants and
Mm-hmm.
it has that negative VIP receptor but high Icarus receptor showing
Mm-hmm.
chemical sensitivity. Okay, so I'm thinking out loud. You guys are watching me think out loud. That might indicate that they have chemical sensitivity, could be from their breast implants. But if it also says they're reacting to actinos on their genie, and maybe they don't feel like their actinos in their home are necessarily high, could they be high internally from their implants, but not necessarily showing up in their dust, or would it show up in their dust?
No, there's no way to tell, and there's no way to be certain of that, right? You would assume, you would have assumed so. You would assume that they could be upregulating all of it because of that. Their exposure's there. You know what I mean? I'm really excited about the whole situation and kind of learning more about it. So maybe we can shed light to all these people that are suffering. I mean, 50%
Yeah,
of
that's
women,
huge.
yeah, 50% of women that implant get symptoms, and many of them are unaware. And, there's like so many of us are attached to them too, because we're just in this world, right? Of what is beautiful and what isn't. And, you know, so a lot of these women, when I try to tell them they're sick from them, are like, what? I can't, I gotta have them. So, I do my best to help them keep them, but
Yeah.
many times there's certain ones that are just never going to get better, and they're never going to accept that it's the implants making them sick. you
So
know.
there's really no way, other than maybe looking at some of these indirect signs that we just talked about on the genie and some of their symptoms, and maybe they're out of mold and they've done the actino protocol for a long time, but they still have high actinos and they're still chemically sensitive, they still have Cirs, then it may be the implants, I'm thinking. But is there any direct testing? There's no, is there like an image or any kind of scan that can be done on implants to see if they are
No, that's the scary.
moldy or like a
No,
problem?
no, there's not. And I wish I should have brought them here. I kept my implants to show you, to show all my patients. I'm like, look, take a look. You know, there is no direct test. So, like I said, I do the VCS, I do the Cirs, so I know that they have molecular hypometabolism. Almost all of them do. They're just not, you're just not aware, you know? And sometimes when you just feel tired, you just, oh, it's just life. And I'm a mom of 4 kids, and they just accept it, you know? But there's no direct test other than knowing that they're reacting to something. You have to like diagnosis of exclusion, right? And then
Oh,
you go backwards, check your house, do your hurt to me, call one of our IEPs, look at your exposure, look at all of that. Or you try to get them better. And again, like I did, you have these lingering symptoms. MRI. So for me, this is a really, I'm going to share it with you guys. Like it's a very sad situation of what's happening because this is, I'm not alone in this situation. Women are going to the plastic surgeons and saying, I feel sick. I think it's my implants. Plastic surgeon is saying, it's not that. It's just not that. It's something else. And sending them away. So 6 months prior to me explanting, I got an intuitive hit that most of women get, that this has to be contributing to my sensitivity. Like I literally would get sick within minutes of walking into a moldy place. Now I do have the sicker, quicker gene, right? So I just intuitively felt like this is toxic load is off and I need him out. And it's contributing to the whole situation. No, no, no. I said, something is wrong. And he's like, no, you're fine. It's just, eat clean, do this, do that, you're fine. And I mean, I'm like, I got to practice to run. I'm like, okay, I'm going to believe you. I'm fine. And here is Dr. Noble with all my education running out of there saying, I'm fine. Six
yeah.
months
But you
later,
wanted to hear, really, right?
yeah,
Yeah.
yeah. Who wants to go through
And-
surgery?
Right.
Costs a lot. There's recovery. You gotta explain to your kids, whole situation. So
Yeah.
yeah, there's a lot involved. So 6 months go by, and I'm like I said, I was like better. I was living in a really nice, place that would take the 5 dogs we had, and I knew I was better. It was 3 months in, and I knew that I had done the whole program, and my eyes weren't twitching, I wasn't getting inner trembling, and I felt pretty good. But again, I wasn't 100%. Like there was something still off. And I was, reading, which I always in the morning do my reading and try to be more up to date with what's going on. And they were saying the number one cause of breast cancer that people first notice is a rash, right? So the next morning, I woke up with a rash on my breast,
Oh,
right?
well.
Yes. So I said, I'm right. And I had that you get fatty lymph nodes and things like that. So I'm like, all around, run to get my mammogram. It's not ruptured. You're fine. I said, it is ruptured. I know it is ruptured. So I take the mammogram. Like I just had this feeling that something had to have been. And believe it or not, I took well call. So I went back on, or either well call or cholestyramine. The rash went away the next morning.
Okay. Interesting.
So by the time I had gone there, literally the rash went away in a day. I just took the binder, gone the next day, and I went to him and I said, I'm 100% certain. So I went back to the surgeon. I'm 100% certain that this is making me sick. Now we're 6 months in, and he's like, no, mm-mm. These are great. I mean, I try to do this for women, everybody come see my work, 14 years later or whatever. Very embarrassing. And I said, they want them out. So let's not have the discussion anymore. They're coming out and you put them in, so you're taking them out. fixed. You know what I mean?
Yeah.
And he agreed. And even when I was in the OR, I'm in pre-op, scared to death. I mean, everybody's scared when they're having anything done. They're marking me, and his wife was his whatever, his right hand. She's a nurse. And she was like, I still don't understand why you're doing this. I still don't. And I'm like, my eyes well up with water. And I'm like, I just told you, I'm sick. I'm not okay. Like something is wrong. And I haven't had one panic attack after explanting. Not once. Not
Wow.
one. I was waking up in the middle of the night trying to catch my breath. It
Right.
was really, really awful. So imagine I'm a doctor and I'm in there and I practice integrative medicine. I'm clearly decreasing my toxic load. I'm clearly doing like my glutathione and all of these things that help your liver detox and all these things. I'm living the life. There's
Yeah.
absolutely no reason that I should be not feeling right. And when we explanted, they did the ultrasound, mammogram, nothing showed the rupture. And he did another ultrasound in his office, not ruptured. This is a fine implant, but okay. Like I was treated like that. Explant after the wife comes up to me and she says, "How did you know?" I was like, "Are you kidding me? How did I know?"
So it had ruptured or it had grown,
It had ruptured.
film or both?
It had ruptured. The one of them had ruptured, and even the other one wasn't a full implant. So where did that gel bleed go?
Mm,
Was it all caught in the capsule? Did some of that absorb into my system, right? Regardless of the
yeah.
one that they couldn't even pick it up because they when people were getting, they called it adjuvant reaction when we had the regular silicone that was like a liquid and people were getting so sick, the Dow Corning implants. Well, they came up with this gummy bear. They called it the gummy bear, all huggable, you know. And they said, "Oh, the gel won't bleed. It'll just stay there." Well, what it also showed is you kind of can't find out. It's harder to see if it is leaking into your system, right?
Right. Yeah. Yeah.
So, you know, they say that 2 months for every year you had your implants does it take to leach all of the toxins out of the fat and bone and everything, you know. So
Oh,
that's what they say. But I was 100, like I said, 3 weeks later, I was, I mean, so good. 6 weeks, I did a biofilm detox, and worked on the biofilm. I'm 100% perfect. I can run 6 miles, I can hike, I can go fast, my brain is
that's so,
really, yeah,
yeah.
yeah.
Wow, so much here. Thank you for going even deeper with your story.
Mhm.
That's helpful to have
Mhm.
all of the details. So you did have a rupture. There was probably biofilm there too. So the types of toxic exposures we're talking about are the heavy metals and all of the chemicals that were in the implant,
Correct,
plus
correct,
likely some biotoxin related stuff.
right,
All of it is a burden on our immune system. And if
correct.
we are trying to recover from SIRS due to like mold in our bathroom and our immune system is already burdened by all this internal stuff, it just makes it that much harder to get well from everything. And you had fixed the mold part. You'd fixed this classic SIRS part, got
Yes,
70% better, and then the explant brought you not only to 100%, but beyond, getting the rest of those toxins out of your body.
correct, correct. And there's so many women that are speaking out, they're, really working hard, but they're missing this. They're
Yeah.
not understanding that there is a chronic inflammatory response involved. And, I don't know if I'm the only person talking about it, but
Let me ask you this, Anjali. I don't know if you remember or if you just kind of know this answer from walking other patients through it, but um, did your SIRS labs stay out of range, even though you had kind of gone through the Shoemaker protocol and recovered 70% because of the implants? Were your SIRS labs still bad, or had they recovered, but you just weren't feeling all the way better?
they were still bad. They
Okay.
weren't as bad. I mean, my C4A went up above 40,000, right? I was sick. but they dropped, but not, they were still elevated. I would still fit the bill for Cirs, even
Okay.
though I was feeling good. And the genie showed the molecular hypometabolism, but no actinobacter mycotoxins or endo at that point.
Mm, okay.
So it was definitely the implants. And that's when I'm like, okay.
Right. You guys who are here, if you have questions, we have a pretty small group, so there'll be time for
Mhm.
questions at the end. I was going to say, go ahead and put a hand in the chat, but I think there's a small enough group that we can just do that at the end. So hold on to your questions. But I want to switch over before we go to questions. I want to switch over to chemical sensitivity with or without breast implants, and maybe even let's start with without breast implants. Somebody who has Cirs and multiple chemical sensitivity. They don't have breast implants, but they're wondering, why am I so sensitive to fragrances and cleaning supplies and I can't go into stores? What's the connection there between chemical sensitivity and Cirs?
So I think a lot of it is the mold Lyme biotoxins are actually the triggering event for the chemical sensitivity. The body starts seeing everything as a cell danger response. So
Mhm.
everything becomes a threat. So, mast cells come into play. Neil Nathan kind of really describes it as his trifecta,
Mhm.
right? He says the limbic system, the vagus nerve, and mast cells. They're the ones triggering sensitivity to the chemical sensitivity, but the biotoxin problem is triggering all of that for them. Then it's triggering this chemical sensitivity where everything is a threat. So the neuroimmune system is just completely off. I think I likened it to post-traumatic stress syndrome of the nervous system. Everything's a threat to the body. It doesn't, every little thing. So a small quarter of polystyrene is going to just trigger them. These people are the hardest to treat because you have to do baby doses of everything. They're sensitive to perfumes, to gas, to quarter dosages of your treatments. EMF makes it all worse. It's a really to have. I think that people were struggling a long time before they got there. And
Yeah.
then, like I think that they were just doing the ignore thing. Oh, this is how you're supposed to feel when you're 50. This is how you're supposed to feel, right? So I think that, and then it's too much for the body to handle. We call it allostatic load now instead of homeostasis. So the
Yeah.
body's wants to regulate itself, but it just can't anymore.
Yeah.
And that's what's creating this. And luckily, there are some really great people that focus on this. And again, everyone that does that's good at something, had it because they can truly understand it. So
Yeah.
the best healers of certain conditions are the ones that dealt with the condition and then are on the other side. So there's I think her name's Anita Miller. She is very good with chemical sensitivity, and she developed this Queasy test, which is you can get it online and you
Q
do it.
U E, is it two E's or one E?
It's
QUESI?
QUEESI.
Okay.
Yeah.
It's like a questionnaire.
It's a questionnaire. QEESI.
Okay.
And that's a longer one. So if you find that you're sensitive to everything and you all of a sudden developed all these food tolerance that you didn't have, or you can eat eggs this day, but you can't eat eggs this day. And sometimes that's because you're in the mold this day and you're not in the mold this day. You know what I'm saying? So that it kind of waxes and wanes for some people too. So that they're not crazy when they say, oh, well, I was reacting to eggs, but then I wasn't reacting to eggs. And they're not crazy. It's just a matter of how much biotoxin and toxic load that they have. And then it's going to create this sensitivity to all the foods.
And then probably nervous system dysregulation, like if you're more stressed that day or less,
Yeah.
or just all the various inputs on your sweet body
Right.
can change your presentation day to day. Yeah.
And everyone's individual. So no, I bet you'll never find two exact patients because we've all had different experiences in life, different chemical exposures in life, like it creates a different human. We have different genetic vulnerabilities. So it's not always the same. But what I love about this test is it kind of categorizes, are you a musculoskeletal person where you have the joint pain, the muscle pain, the fatigue, the cramping? Are you that person? Or then it has the brain, and it kind of like goes through all the systems, and with your symptoms, it categorizes which way you tend to point towards,
The
and it
queen
points
you're
toward
talking about?
the Queasy test, quick environmental exposure sensitivity inventory or something it's called. Or the tilt test. And if you just Google tilt for environmental sensitivity, I think that it'll come up, and you can do it right online. And I have my patients that fail, like I ask them the quick, and it's called Brevi, the quick brief environmental. Are you sensitive to everything? Do you have implants? Da 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 da. And then if they say yes to two out of three of those, then I make them do the inventory. And then you can monitor them just like with the VCS, like how we monitor, you can monitor them with this symptom questionnaire. So it's nice that we're getting some, objective things to try to, tools.
So if somebody has chemical sensitivity and or MCAS, would you need to treat their exposure, or like mitigate the exposures like we would with Cirs and mold and bacteria? Like, are you having people get into a home that is low chemical or use air purifiers, change out their personal care products? Do we need to do all of that in order to calm the system? Or are you able to apply nervous system support and like supplements to calm it from the outside in? What's your approach there?
So most importantly, you've got to calm down the nervous system. You have to have them doing some type of practice that's going to get into the parasympathetic system. Even those heart math, aren't you a heart math certified? Yeah, like that, those techniques are great too. And you can follow it with the heart rate variability, right? So all of that is key. You've got to calm down the nervous system, and you've got to work on that access. Then, of course, you want to decrease your toxic load. It's the same thing. You got to get out of exposure. So you got to get out of the stress exposure. You got to get out of the chemical exposure, and you got to get out of the biotoxin exposure. You got to get out of exposure, or
Yeah.
you're going to stay sick. So you got to work on the mind. That's why I wrote that in my newsletters in that order, because I felt like I'm trying to make, people understand that it's not just, you're not an isolated chemical. You're
Yeah.
you have so many things that are creating the system to go haywire. So you have to get out of exposure. You have to do the things that you can do, and then you have to make sure that your detoxification systems are working, just the general ones. You drinking enough water? Are you making sure your bowels are moving? Are you exercising so you're, doing moving? You can't move toxins if you're not moving. So all of these things, even a little movement is going to help. Going out in nature and grounding to calm the nervous system. I mean, it's just a combination of so many things. And it shouldn't really look like a chore. It should be like, oh my God, I'm getting healthy again. This is going to be great.
Yeah. Yeah. Um, does sauna help remove chemicals?
So that is literally the best thing that we have right now is, of course, to remove toxins, it has to come out through the urine, the stool, or the sweat. And then your liver has to be detoxified, being able to detoxify, right? So all of these things come into play, into consideration when I'm treating somebody. And saunas are the best way that we have the most science on right now. So if you look at, you know, Pizzerno's and, environmental medicine book, that first one ever, I mean, which is crazy that we just recently have the first textbook in environmental medicine ever, right? Um, he really only talks about the sauna, and they basically, all types of sauna work, where we, in functional medicine we talk more about infrared saunas because it pulls from, in out and doesn't just heat up the outside. But according to the studies, they're both equally as effective as sweating out the toxins. But what I find important, because I do have an infrared in my practice, I also have, ozone, something called a HOCAT or HOCAT. where you get, hyperthermia, fibrospecific microcurrent. So there's energy medicine in there, and there's carbonic anhydrase to open up your pores so you can then absorb ozone. And so you detox everything out, you absorb ozone, but then what you have to do is, especially with infrared saunas, is you have to wipe down with a cold rag, because if you don't, throughout the day, you're just going to absorb all those toxins again.
You want to get them off your skin.
You want to get them off your skin, and people miss that. You really should be wiping down with a cool cloth, um, to
Could you
close
just take a
the
shower
pores.
after? Is that different?
You could. You
Okay.
could even wash them off and take a shower after. So that's hard. So I have an infrared sauna, but I prefer place it as a gym or something that you can shower right after or something like that. I don't have the capability to do that, but that would be better. And now they have something called plasmapheresis and apheresis that's becoming more and more popular. And there aren't as much studies on it, but I have a feeling it's getting to be really popular now. And that's catching
Removal of chemicals, heavy metals, biotoxins. What does it help mobilize?
right now. They're looking at it more for toxins,
Okay.
but people are starting to bring it into their practices now, and it's becoming more readily available. Um, it's something that maybe I'll consider in a year or something. I want to see more data before, you know, but I like that. I think that that might be, something that we can look forward to and get a lot of these patients, because it's catching it in a filter, you know.
Okay.
It's
Okay.
different than that ozone and all that. It's different. The EVOO, which I'm not a huge fan of.
Okay.
Hmm.
Tell us this before we open it up to questions. If somebody knows that they're really sensitive to VOCs and chemicals, could that in itself impact their Cirs labs or their VCS test?
So with volatile organic compounds, they disrupt the VCS test. And many of the studies say it's irreversible if it's VOSs. Yeah. It's like it's not, you're not able to correct that. That's what the studies show, if you look at all the studies. Um,
That you will never pass the VCS test, or there
yeah,
are certain
yeah.
ones that you'll always just keep getting wrong, but you might be able to recover in other
It
areas?
says you'll always have problems with contrast, and visual
That
sense.
indicates it must be a significant exposure, or not necessarily, just how it interacted with your inner terrain at that time.
I think it's just how it interacts with you. We're all individual beings with all our different exposures as we go on. We're all inhaling gas every day. I mean, I have an electric car now, but
Right. So like we're clearly
yeah.
all around chemicals, and many of us are passing the VCS test, but there are
Yeah.
some people who have a big enough hit at the wrong time and they may not recover. But they might be recovering from mold or from classic Cirs and may still be able to feel better. I don't know. What do you see? Do you
Yeah,
see some people
I do.
stop like they
You'll
always
definitely
have?
be able to feel better, but I think when it's mainly VOC based, we're going to have a harder time with them if we're just following the VCS test, because sometimes we do that in patients that can't afford and don't have insurance, and but you're going to have a dysregulation of all of the Cirs stuff, and I think that will normalize. But apparently, according to the data, the VCS test is a much harder thing to correct. Would
Even
be
if you're doing the chemical detox stuff like glutathione and sauna,
Yeah, you
work
have to be
for,
honest, I don't know,
you know.
I haven't seen it correct in anyone yet. So I don't know. I have had a patient that had implants and was very sick with mold and passed the VCS. So, after years, so I have seen that. A lot of women that don't think they're sick, they fail the VCS and they have implants. Every single one of my implant patients failed the VCS. Every
And then
single.
do they pass it after explant?
Some of them don't explant. They're not going to believe that that's their problem, you
Yeah.
know. Um, but they do. They do. I see the
With
majority of
all the
them.
therapies that they make,
Yes.
talk to the
Yes.
protocols and
Yeah.
everything.
Even the one that I followed, she was young, but she failed the VCS. Her Cirs symptoms were all up. She explanted, didn't even do the Cirs protocol. Okay, she really didn't. She eats fiber and stuff like that. So there's other ways, right? She had a healthy system. She ate really clean. Like she was good. She explanted and everything got normal. So we didn't even do anything. Like a month later, she basically ate healthy fiber, things like that, and her everything normalized. It was miraculous. So there's some, I mean, it's inflammation. You're
Yeah.
getting chronic inflammation from the implants, and it's dysregulating the immune system in a very similar way. But they find rheumatoid arthritis, scleroderma, and Sjogren's syndrome to be very common in patients that have implants. Those are the three autoimmune
Um,
issues
okay.
that they're seeing too. And the most common symptoms in the most recent study is fatigue, muscle, joint, and the brain fog. Those are the main, but the joints and muscles hurt, they get the fatigue and they get the brain stuff. And then, you get anxiety and depression, 20% of the time, but it's pretty high numbers. Like almost 60% of people with implants get fatigue, you know, they're fatigued.
There's
So, and,
a lot of crossover with what we consider Cirs symptoms. So yeah, we've got to look at this. And did I understand correctly that you were implying our Cirs labs can be dysregulated because of the
the
implant?
implant, yes.
Wow. And so
Yeah.
if you're doing all of the things, you're out of mold, you did the endotoxin stuff, you're even working on actinos, and you're like, what is it? I'm not getting better. I'm stuck. It could be, if you have implants, then it could be
It's your,
that.
it,
Getting the explants could then normalize those labs. So are there certain labs like MMP9, TGF beta? Are there certain labs that you see like as getting stuck and then resolving with the rest of
you know what? They're all just mildly elevated. They're all just
all of
off,
it? Yeah.
all of it. Of course, I don't see, C3A, that I don't see. But I do see, activated C4. I see all of that, more like you're not going to be in the 17 to 18,000 and up range. You're more like 6,000, 5,000, 6,000, like those lower levels, but they're up. They're
Yeah.
not, they're not normal.
So, keep having more questions and I want to move it to the group. There are some people who had Cirs, they have
Yeah.
implants,
Yeah.
and they do the Shoemaker protocol and they do all of the things, and maybe they work on their nervous system and all of the stuff, the inner terrain, and they do get better and their labs get better and they feel like they're back to 100% and they kept their implants. What do you think they did differently than people who weren't able to do that? Do you think maybe they didn't have some of the trauma, or they were just able to really work on improving their window of tolerance for that excess kind of toxic burden, where they're able to tolerate it maybe more than the next person because of they just cleaned other things and did so much inner work?
I do believe, and there are women that I try to help them keep their implants because they're so attached, right? So we work on, detoxification. We do super, things to work on histamine and all of these kind of things so they can keep their implants. These are people that have to eat well, do saunas. Why are we getting, 47% increase of cancers with alcohol? What do you think it is? It's toxic related. You're plugging up the liver. Your glutathione is nothing. You can't detox anything, right? And then, I tell all my patients, if you want to keep them, I understand I'm going to help you do that. But
Mhm.
drinking is really not a very good
Yeah.
idea for you,
So
right?
maintain a clean
If you,
system.
you have to keep that liver like functioning as best as you can. So that is like key to keeping, your implants longer and not being affected by them is just alcohol is just so bad for breast cancer and toxins,
Yeah.
because it's depleting that. And some of them are like taking glutathione because they still want to drink. Everybody, you got to enjoy your life. It's all personal. I can only give you the knowledge, and it's your choice of how you want to live life, right?
Yeah.
So,
Last question for you. Some people get their implants out and they look at them and they're like, well, shoot, they're intact. They didn't leak. And they're not moldy. At least I don't see anything.
mhm.
I shouldn't have gotten them out, or maybe I can just put them back in. But what I'm hearing you say is they don't necessarily have to be leaking and they don't necessarily show visible signs of mold, but they can still have biofilm, actinos, which may not be visible, and they're just leaching chemicals, even through the outer shell, even if it's intact, it's a
Mhm.
toxic burden on our immune system with the heavy metals and the chemicals. So it's not necessarily a visible problem that you're going
No,
to see when you take them out.
correct. And it, that's what makes it so scary. I mean, even when you look at, the patient when I did the documentary under my implants, she was young and healthy and, and she had everything dysregulated. Would she have stayed healthy 10 years later? No, I don't believe so. Because you have that many more years to develop more toxins, and we have persistent toxins that get in our system. We all know there's forever chemicals, right? They're in there forever. And then you get them and get them and get them and get them, and they accumulate as we age.
Right.
And we're in a harder state. But I do believe that some people can do fine with their implants. So, but all of my patients, not most, are so happy when they're so happy when they explant. I mean, they're just like,
Especially if
oh,
they're very
thank God.
menopausal, right? And they already are having some burdens on their cognitive health and their energy and their musculoskeletal system from the shift in hormones. And then
Mhm.
if they also have that extra toxic burden, and lo and behold, if they also have Cirs, like we need to just take something off of our plate to let our immune system and our
Yeah.
endocrine system kind of
Yeah, and I just let them
right.
make them aware that so it's all about toxins in and increasing toxins out, right? Lowering toxins in, increasing toxins out. That's the goal, to decrease the toxic load or the allostatic load, however you want to say it. And basically, you're starting out with a full bucket.
Yeah.
You
Yeah.
got implants, you're starting out with a full bucket, and it's your choice. And we can keep, trying to empty the bucket as best as we can with saunas and all of these other things, and you hopefully will stay well. But you have to be an active participator in staying well to keep them. And this whole thing that these surgeons are sending everybody away saying they're lifetime devices, I mean, we all know they're not.
Yeah. They're trying to protect their own industry, not necessarily our long-term health.
Yeah. Yeah.
Gosh, Anjali, thank you for this. I want to open it up to the group and see what kind of questions they might have while you're here live. That's one of the amazing things of these special guest events is this isn't a pre-recorded podcast. We have Anjali Noble here with us right now, and she can answer your questions. So don't be shy. This is a small group, so this is perfect. Does anybody have a question? Anything's okay. We've got the specialist with us. Anybody?
Yeah.
Let a few moments go by in case anyone's feeling shy.
I know. It's probably depressed from all the chemical toxicity. And, sometimes it can feel depressing.
Yeah.
Yeah. Yeah. You just do your best.
Marcia, I saw that you unmuted. Do you have a question?
You're
No.
really funny. You don't miss anything ever. I'm pushing all these buttons. It's not a few minutes to think. It's a few minutes to do the technology. Okay, wait a
Hey.
minute. I got the chat instead of the. Oh my gosh, you are just brilliant and amazing.
Oh,
And I'm
that's
not even dealing. I'm not even dealing with those issues. But you just taught me so much more about Cirs that I just on the sideline. I guess I
oh,
have a couple. Yeah, no, really. And Jenny was right. You're being very vulnerable and transparent, and
yeah.
that matters. I think you're right. The people that have been through it can
Yeah.
help people better. And I think people have more faith in them also because they're not just saying, I don't know.
They've done it. Yeah.
Yeah.
Right.
Yeah.
I have just a couple basic questions. I have a question about um, chemical sensitivities. I didn't. I don't have a definition of that in my brain and biofilm in my brain, like related to this topic. But like I have a cleaning issues. Like I want to clean everything, and I'm clean everything like with Lysol and alcohol, like just so stuff is clean. To the I don't want to say germ phobia, but that's being transparent too. So I'm clean. I want to clean everything, but I feel like sometimes I see, like if I'm doing a lot of cleaning, I can see redness in the creases of my elbow, like where the blood, like where it's more inflamed. And you say to the dermatologist, this red, and they say, do you want something for that redness? No, I want to know what's causing it. Like my association with it. But chemical sensitivities, and I understand I should put on gloves, but in the moment you might not be, you're doing something and you you don't stop or you don't do it, which is stupid. I understand that, but chemical sensitivities like that are part of this or not part of this.
Of Cirs?
Hmm.
So it is part of it. So not everyone is chemically sensitive. Um, I know that, some people just have the brain issue and they're not chemically sensitive. So a lot of my patients aren't chemically sensitive with this. And when you are chemically sensitive, the only way to really tell is your symptoms and how you feel. Do you react to everything? Not really, right? Do you react to all the foods you eat? Do you get GI distress? Do you get runny nose? You know, every time you eat something? No, right? So are
No,
you
it's not.
to
No.
perfumes and you get it like, have to lay down after, you smell gas somewhere, like those kind of things. Are you sensitive?
Perfumes are, yes, those are not okay. Like if my mother would wear perfume, I couldn't swallow, I couldn't breathe.
Okay, so maybe there is a little bit of chemical sensitivity there, and you may be one of those people. Did you react? Did you take binders or anything yet?
Yes, no
Did
issues though.
Okay, so that's good. So maybe,
Yes.
a small amount of chemical sensitivity, or you're adding too much into your system because it is absorbing into your hand. So, I don't know what, chemicals you're using, but there are really good chemicals that are softer on the system. Like just, if you talk to all the IEPs, like just dish soap and water and lemon, it works, and that's not, you wouldn't and shouldn't react to that. But if you were chemically sensitive, like you would know, like if you were extra chemically sensitive, are you able to drink a glass of wine or
I
alcohol?
don't. I really don't know. I mean,
Chemically sensitive people can't tolerate alcohol either. They usually can't
okay.
tolerate, either.
And
Um,
with those of us who are wanting to sanitize certain areas, not just clean like the mold, but like disinfect, I don't know, the sink or the toilet or whatever, and we need to use something a little bit more than soap and water. Is there a disinfectant that you would recognize when we need to go that extra level for those areas?
What I do for those areas is I don't really touch it. I use one from Whole Foods. I don't know the name of it. It's not, true. It's not as severe. And I
Um,
get it from Whole Foods and I spray it and let it dry. And then I just wipe it down with a wet cloth after. So I just let it dry there. Like I'm not touching it, and you really shouldn't be touching the chemicals. And if you're getting red in that area, it is you being reacting to something. That's usually your body reacting to something. So usually when it's in the folds of your elbows and in your arms and stuff, it's usually either food reaction or a chemical reaction. And you want to stop that because like I said, it's the toxic load. So you keep doing it, doing it, doing it, doing it until then you're really reacting, because it's building
Okay.
system. So my
or it
suggestion,
could just be impeding SIRS recovery because it's one more thing that your immune system and your detox pathways are having to manage when you want it to really just be managing the mold and environmental, the water damage stuff, not having to manage extra toxins that are more controllable.
yeah, because it's good, it's causing some oxidative stress in the body. And when people have chemical toxicity, it's really hard to test toxicity. We do it by doing oxidative stress markers and looking at the GGT levels, and that's how we can kind of check on that. And then if there's a lot of oxidative stress, even if sometimes when you do these toxin tests, it doesn't show because it's in your bones. It needs to be provoked out. But if you have a lot of oxidative stress, that usually is chemically related. Almost all of my SIRS patients, I would say 90%, and I'm just guesstimating, like, have oxidative stress. They show with oxidative stress on the test because I test my patients for that. You know,
You test with, you said GGT.
I do test a GGT and I test oxidative stress markers.
Oh, okay. You can do that directly. Cool. Okay.
Yeah. You can
Okay.
do that directly. It will tell you more than the chemical issues. You know,
Is there a name for the oxidative stress test or markers?
well, it's 8-deoxy, it's an enzyme,
Uh,
deoxide enzyme, and it tests oxidative stress. There's also, you can test uh prostanes in the urine, but I don't do that one as much. I do the deoxy one.
okay, cool.
Um, because I do a lot of specialized tests.
Yeah.
And we get nutrients, we look at mitochondrial stuff, and then we look at the oxidative stress and to see if there's a high toxic load in the body also. It looks at their reaction to gases and all of that, and it does like do that. But I have had patients that had implants that only showed the oxidative stress and they didn't show toxicity per se, but they had the oxidative stress.
And
So
we
that's
know that oxidative stress is tough on our mitochondria. And if we have Cirs, we don't want extra burdens on our mitochondria or our DNA, right?
correct. You're going to dysfunction and you're going to have less energy production and you feel worse, you know.
Okay. Marcia, did you have another question? And did that answer your first one?
That answered my first one very well, thank you. And let somebody else have a chance, and if we still have time, I'll ask another one or two. Because
Okay.
this is really like
Yeah.
unbelievably intricate and fascinating. I can see that it's, oh man, I don't know. You just opened a lot of doors. Where in Florida are you? I'll ask that one.
I'm in my office is in
Okay, thank you.
Boca Raton.
Marcia's
Okay.
in Florida. Yeah.
Yeah,
Floridians.
I know.
Who else has a question? Love to answer anything that anybody has. Abby, I saw you pop on.
Yeah, I'd love to ask. I don't know if it's related, but I'm just was curious. I know I am chemically sensitive, and I was thinking of getting my varicose veins injected. Would that be a chemical that would be a problem? And if you'd have an answer for that. And also the second part is, what do you do to supplement to help us detox these chemicals?
Okay. So the vein, some people just use saline for that, and it's not toxic to the body. It just depends on what your person's using. They're different chemicals, but in general, they're really not that toxic for veins. And especially if they're using the saline injections for them, because some of them just inject it with that. Um, so I wouldn't worry about that so much. Okay. Go forward with that. It's not like you're putting an implant in a foreign body, like, you'll process it. I don't know how many veins you have, but in general, I don't find it to be a problem when you do that. In terms of supplements that I use, the most important one I was talking about is called glutathione. So that's what depletes over time in the body, and it's our main antioxidant and our main detoxifier. We're finding Tylenol to be such a big problem in our community because Tylenol and alcohol deplete this glutathione. When I was working in the ICU at Jackson Memorial, we had a lot of people try to commit suicide that way. Bottle of vodka, bottle of Tylenol, you're surely going to shut off your liver. There's no glutathione to live anymore. So those things, not taking any Tylenol, making sure that you supplement with glutathione, making sure that you limit your alcohol intake are huge. So lifestyle things are the most important. Making sure you move, making sure you ground yourself, breathe, meditate, do all of those calming things. And then you can move on to supplements when you've calmed down the system. Because if you just start taking supplements and your body's not ready, it's going to reject them. So, and you don't want to waste your money. So I like quercetin a lot as well. And if you are having food sensitivities and stuff like that, you can take just quercetin, and you take it 30 minutes before eating. So people who have the GI symptoms and sensitive to everything, it works really well. And it also works for the headaches and the nasal stuff and all of that. So you can take quercetin like 30 minutes before every meal. That actually helps with chemical sensitivity. And then, I always make sure that my patients have their bowels moving really well. If you're constipated, you have to remember that all the toxins are having all that time to leach out of what you've eaten and recirculate into the gut. And when you have Cirs, you get those tight junctions or those cells that are tight in the gut kind of, not being so tight. So you have a leaky gut and you have a leaky brain when you have Cirs many times. So you have to be, very cognizant of your toxic load and what you're eating, making sure you're watching microplastics, making sure you're drinking out of, steel containers and glass containers, watching, believe it or not, I did a newsletter on this about the microplastics that led into this. Because everything's in plastic. I mean, our whole world is in plastic. It's so hard to get out. I mean, we're living in a toxic soup. I swear it's so hard, but you do your best. And now, chewing gum has plastic now, or tea bags. So you have to look at your tea. Like, I'm a tea freak. When you don't drink, you drink tea. You know what I mean? And then if you have tea bags that are toxic, I was like, what? But they're the real pretty ones with the silk. Those are the ones that are toxic. Yeah, you want, or the nylon ones, like those real special ones with the little like triangle and you know what I mean? So you have to do, Numi is a good brand, Celestial Teas, and usually it says on the box what it's made of. So you don't want the nylon, you want it to be like made of bamboo or something like that. That's easy adjustable. There's all these little tricks to decrease your toxic load, and you can really just do your best because you have to live. But so that's really important. And then a lot of times just making sure you're eating like red onions, high quercetin foods, fiber. A lot of times we can't get enough fiber in our diet. And there are studies that fiber can pull biotoxin. And that's just so important, for you, is to make sure that your bowels are very active and moving. So that's super important because the gut's so dysregulated in Cirs. You get that leaky, and then you get the chemicals leaking right in. That's why you become more sensitive, because you've got this leaky gut. All the chemicals can recirculate, and then so you're even more susceptible to having more toxic load when you've got Cirs because of this leaky gut. And it all goes to your brain. They found plastics in the brain now. They're finding it like lodging in the brain. So it's in it, and these phthalates causing infertility in the boys and in men. Toxins are a big, big problem. There's like 50,000 chemicals that are used, and I think we know about 500. And it's crazy,
Wow.
Yeah, we just do our best. Like, it's not good. Like, you don't want to just regulate your stress response because you're so stressed about it. You just have to do your best and make sure you sweat. Like, if you could go to the gym, and maybe your gym has a sauna, and you only need to be in there 8 minutes after you sweat. You don't have to like get completely like dehydrated. You can just 8 minutes after you sweat, you're doing good already. Exercise is great. You are releasing stuff but the studies show that it's not as good as a sauna to sweat from exercise.
Yeah. Great. Such great information. Was that helpful, Debbie? Did you have a follow-up question?
I do have one follow-up about what role does CSM play in helping detox any of these?
Okay. I think it does wonders. Like I said, I had the rash. I took my cholestyramine and the rash was gone the next day. Like, I believe that it definitely, whatever toxicity was there, it helped. Because what cholestyramine does, it's definitely the most effective to get rid of biotoxins. We know that. We have the studies to prove it. But it also will get rid of some other toxins too, because you're promoting the enterohepatic circulation, and that gallbladder, sorry, that's a little big word. So the gallbladder liver is able to process things together because of that. So anything that's fat soluble will also be improved with that. And many of these toxins are stored in the fat. So, getting that system moving is really good.
So it's not all about the charge of the toxins. It can also be whether it's fat soluble or not.
I think it'll pull, if it's fat soluble, it will also pull it out as well. Now, a lot of toxins, for liver detoxification and gut, helping, of course, you want to make sure your microbiome is good in your gut. because chemicals and Cirs dysregulate that microbiome. And then you also, there are other things that people do, like the pectosol, charcoal, zeolite, like all those traditional things that pull toxins can also be used. And I give my patients a diagram of all the nutrients that support detoxification. But if they're not pooping, I tell them you just got to make sure you're pooping, because if you're not, I hate to use that term, but you got to be moving bowels, because you can get the liver to start working better, right? And then you get this intermediate metabolite that forms, like with Tylenol, that metabolite can be more toxic than the original substance. So if you're not moving your bowels and you're not hydrating and all of those things, you can feel worse. So you have to know about all of
I
that.
start from the bottom up, it sounds like.
Yeah. Yeah. Because now we consider, going stooling and pooping, whatever, phase 3 detoxification. So one's the liver component, 2 is being able to pee and, process it, like it different mechanisms to make it water soluble, to be moved out of the system. And then you have to be able to move it out of the system. So that's phase 3.
Yeah, yeah.
Right. Thank you. That was just great. Thank you.
I hope it was helpful.
It was very helpful.
Great information. Anybody else? We've got a couple minutes left. Anybody who hasn't shared yet? Yeah, Melissa, saw your hand.
Yeah. Jenny, Dr. Noble, really glad that you're like talking about this, because this has been my journey. I got the implants in 99. I wrote down my whole like kind of bio on this in the chat. And so like a lot of what you shared has also been my experience. And I feel like, like from the very beginning, I felt like these implants, they just weren't working, they were really painful, and I had, symptoms. And then 10 years later, I felt like it was disintegrating and I wanted them out, but I switched them as opposed to remove them. And then, 4.5 years later, one of them partially ruptured. And so and I was having, a full-blown Cirs attack because I moved into a moldy home with EMF issues as well. And I'm also on a golf course, so I have got the VOCs from the golf, course and everything spraying in my face all the time. And that's why I mentioned the VOC. To me, I didn't realize, I'm sorry, I'm kind of wandering a little bit, but I didn't realize the Air Oasis isn't as good at VOC removal. And so when I got, sleep has been such a problem for me. And when I got the multi-gas from AirIQ, within 2 hours, I decided I wanted to take a 5-minute nap at 6 o'clock in the evening. And without any of my typical evening supplements, I slept for 13 hours. And that to me was like, I haven't slept like that forever, and I mean,
the IQ Air multi-gas unit seemed to really bump up VOC elimination from your air more so than the Air Oasis, is what you're saying?
Yeah, it helped, because I have a lot of the Air Oasis, and that has been a godsend for the mold, but it really actually does not treat VOCs the way the multi-gas does. And the multi-gas is that's its specialty, and so having both of those in my bedroom has made all the difference in the world. And I know that they're expensive, but I want to get 2 more, one for my office and one for the main space, because they really have helped a lot. And I know not everybody lives on a golf course, but still, just from all of our materials in our homes and everything, it's just so hard. The VOCs are such a load, and especially if you have implants on top of it, that you're, if I've had my implants for 15 years, then that means that, based on what you said, it's like another 2, I still have another like 1.5 years to go of diligent detoxing, just to hopefully get anywhere close to where other people are. And and so, another thing that I'm looking into, but I'm trying to do everything, I'm trying to do the VIP and all these other things, which are really, all of this is so ungodly expensive,
It
know,
is.
and energy consuming and all of that. But, I am looking into the innisphoresis, and that's something that can only be done in Europe. But I've, based on, in particular, my genetics and everything, the specificity of it is really remarkable. And actually, when you price it out, it's quite affordable in comparison to what plasmapheresis is here in the States. And so and it's for long COVID and all these other things that I also have. So to me, I'm kind of looking into that. And then go
Yeah,
ahead.
that would be a great option for you. And I did hear that about the IQ Air being better for VOCs, and then the, Air Oasis being better for the mold. I know about that, but I do have patients that have the VOCs and they do that, like what you're doing. That was a great catch.
Yeah.
Yeah,
Yeah. I mean, as when I've just, and this just happened, and like when I discovered that, it was just kind of like this massive light bulb of, because I've really been struggling with how do I deal with the fact that, I'm on this golf course and I have VOCs in my home, and, and I can smell it, inside and outside, and how do I, without moving, how do I,
yeah,
deal with the situation that I'm in.
yeah. Well, you look great. So, your eyes are nice and bright. So, when I look at you, I don't see somebody sick. So, every day is a bright new day,
Yeah.
I hope
Yeah.
you do Europe and do that and let me know.
Yeah, I know. I'm again
Report back.
really happy to get to know you, and I'd love to stay connected, just because again, I feel like we're both on the same, well, all three of us we're all on the same mission, and but we share the same experience, and I worked in a plastic surgeon's office for 15 years. So my doctor, my you know my boss, took them in, and he also took them out. And so, I understand what it's like, on all perspectives, being in a doctor's office, being, a patient, and, and, the doctor's perspective, so I understand it all, and it is complex, and it's amazing how even the kindest, most intelligent doctors still, they're not quite seeing it, just like with Cirs, they're just not seeing what's blatantly in front of all of our eyes,
I,
right?
I even brought him my paper that I wrote. Like I brought it. I'm like, look, I don't know. He probably threw in the trash. I have no idea what he did, but they're not getting it.
They're
And
not.
just don't understand. I think part of it is like, oh my God, I've been putting these in people for all these years. Like, you have to, like, wouldn't you feel bad? Like if you're not, because I don't believe, and maybe I'm naive, that the doctors are all about the money, but maybe they are. I just feel, because I think the majority of doctors that really actually go into medicine to want to do some good. I
Yeah.
do. I still
Yeah.
believe in the goodness of mankind. I just think you don't know what you don't know. You
Yeah.
know what I mean?
It's an inconvenient truth, and they just want to shove it under the rug, because they have so many people that are so thrilled. But, then again, the more we continue to understand our genetics and our history and all of that, the more, doctors need to make more informed decisions in how they talk to their patients.
Yeah, they really
Even
do.
before they get their implants, it's like, hey, let's just check let's just do a VCS test before you get your implants put in. That's like a $15 inexpensive test.
I have I
Right?
have a friend that has lupus. Okay. She has lupus or juvenile rheumatoid. We don't know which one it was. They put implants in her. I was like, how could you put implants in her? Like, what are you doing?
Right.
You know what I mean? Like,
Yeah.
it's
Setting
common.
her up to
I
fail.
basically told her I would never do that if I were you. I mean, she did it anyway because the society is just, it really gets to women. We need to realize that we're beautiful just the way we are. And there's some natural things we can do that are less harmful beautiful than others, but putting a foreign body is a little extreme. It is extreme. And when I did it, I was just so like taken aback by my body change after the kids. I was pregnant or nursing for 6 straight years. And I was like, oh God, this is, I don't know if I feel sexy or whatever. You know what I mean? I mean, it really does a mind, trick on you. But we have to start becoming a society that's happy. I'm so happy now. Like
Oh,
I,
me too. Oh my gosh. And today, because of this call, I'm not like a social media person or anything like that, but I actually did take a photo of myself as I was walking into surgery because my friends wanted to see what I looked like. And then I took a photo, I think like less than 24 hours later, and it is night and day the difference. I was hiking in Torrey Pines. I was like, my eyes were bright. I mean, it made all the difference in the world. And the first photo, like my face is all swollen, and I mean, you could just see how much pain I was in. It's just it's
yeah.
crazy. So I'm happy to share that in our
Yeah.
community.
And I know you spoke about how important it is, I don't know if people that are going to do the video and see the video is to make sure that you address the capsule and you did
That's
the
what
edit.
I wanted to bring up, and I want to honor your time, Anjali, because I know we've gone a little over here. But there was one more comment from somebody who went through this and wanted to make sure we addressed, what was it, M block total capsulectomy, that if you're going to get things removed, you need to get the whole capsule removed and not just the implant.
If you are sick, you really should do it that way, right? But it can get dangerous for some because what under the muscle, it just sticks to your ribs and everything else. So it is a trickier procedure. So really be careful about who you go to. And remember, just try to use your gut instinct and intuition, because some of these guys, like, there's good and bad. Some of them are ego driven and not, person driven. I've seen them. I looked at every doctor that there is to see what they're doing. So removing as much of the capsule as possible is the best bet, and N block is the best bet. But, some people can get away with the capsulectomy. Now, doing nothing with the capsule and leaving it in there. I mean, I had a patient, she had her saline implant deflate, and you know what they did? No, you're gonna be shocked. They deflated the other one and said, just keep the shell.
Oh, God.
And she's like that today. She's about 20 pounds heavier than she was. I
Right.
don't know anything else, but she doesn't look well. And
Oh,
who, her
wow.
doctor, I'm not gonna sit, you know what I mean? I mean, it's a scary situation out there.
Wow. Wow.
Yeah.
Anjali, before we go, and I'll ask if there's more time, but I really want to honor Anjali's time because I know we're already 10 minutes over. If people are resonating with your story, with your practice, tell us a little bit about, are you taking new patients? And if so, do they have to live in Florida?
You don't have to live in Florida, and I am getting licensed in other states because there's so many people that call for my help. I do have a lot of movement in my schedule. So I am, I spend a lot of time with my new patients. So I only take like 3 or 4 a week. So I have room for my established patients to get in. So I'm booking into, I think, early February right now, but I do have movement, and there's movement in the schedule all the time. And then I have space.
Could move up earlier. There could be a cancellation or something like
So I
that.
would just get your appointment and then say, talk to my office manager and say, oh, I saw her at the podcast or whatever this is called. And I would love to try to get in sooner. Can you put me on the cancellation list? And she'll do that. And you can say I'm an established Cirs patient. And then you can email me directly at drnoble@drnoble.com. It's easier. drnoble.com. I also have another email that's drnoble@noblehealthyaging.com. But both of those work.
Okay. Okay. And for that initial consult with you, can they be in any state for that initial thing? And then you would decide if you can take them on as a long-term,
They-
patient there.
But I do wish I could see them once a year. Like legally, I'm supposed to see them in person once a year.
Okay.
So
Okay. So we could fly into Florida, have a little vacation and see you.
yeah, legally, until I get licensed in your state, that's what I should be doing, is making sure that I see. And most of my patients do that. They come fly in and see me in person, even if it's just for the physical in 3 months or something. They come for the follow-up or something like that. So, and if you wanted to make an appointment, you can always go to my website, drnoble.com, www.drnoble.com, and there's message thing, and my office manager gets it and I get it. So you can always respond.
Awesome. So for
Mhm.
those who maybe came late, Dr. Noble is a fully shoemaker certified physician. So some of us are shoemaker proficiency partners. It's a slightly shorter route to training. She's fully certified and she is a physician, so can write prescriptions. She can work with you to personalize things. She's the full shebang, plus women's health, hormones, chemicals, breast implants, all of that we know not all of the shoemaker doctors know how to treat. So thyroid, autoimmunity, like all the functional medicine stuff, in addition to Cirs. I just think that's fantastic that you can do it all as a functional and integrative DO. So just wanted to remind you all of that she's got a lot of tools in her toolbox and a lot of credentials. Well, Anjali, do you have time for one more comment or question from Melissa, or do we need to go? I know we're already way over.
Want to ask a question?
One more. Melissa, do you want to pop back on? I know I saw your hand up. I didn't know if you had one more comment or question before we part. And if not, then there she comes.
Oh, there she's again.
My thing was dying, so I just needed to charge it. I was just mentioning that I did have the capsulectomy the first time, but when I switched out my implants, but the second time, because my health was
Not well.
Oh no, she froze.
Yeah.
Guess what she's
anesthesia and everything, that we decided to not do anything and to just keep that capsule there. And it was still amazingly beneficial. So I think it is like, you really have to take it person by person.
And what is the risk? It's all everything that you do in life, risk benefit.
And just
Right?
to clarify, the capsule is not the shell of the implant. We are taking that out. The capsule is your own, it's like the scar tissue and stuff that's formed around it. It's your tissue.
The theory is the majority of the chemicals that leach are trapped there. But
Oh,
they're going into your system, because I mean, I wouldn't have had the brain fog and all of that. And I actually had one that was an en bloc, the one you have to take the whole capsule out when it's ruptured. And then I don't know about the other one. It said a capsulectomy. I didn't do an en bloc. And like I said, 3 weeks later, I was 100% better. So this whole, like, you must do an en bloc, it just depends on how sick you are. And if it can be more riskier to do it. So you got to judge on the risk benefit of what you're doing. And I'm glad that you brought that up.
yeah. Awesome.
All right.
All right. Well, everybody, wow. Thank you for coming and for bringing your good comments, stories, excuse me, questions. Dr. Noble, thank you for sharing so transparently and giving so much of your wisdom with us.
Oh,
So
nice.
grateful for you.
Clearly you can
Thank you. Thank you. Thank you.
super passionate about getting everybody to be happier and healthier.
Love it. And you guys check out the replay of the interview that I did with Anjali from the 2024 Cirs Summit. It's free right now. And if you don't know how to find it, I can give you the link. The discount code is free for me with a numeral 4. But Anjali and I did a discussion about Cirs and hormones. So she talked all about like female hormones and menopause and male hormones too, also thyroid hormones. So if you want to know more about like the Cirs and hormone interplay, she is a specialist in that as well and had so much information to share in that presentation. So Anjali, have a wonderful weekend. Everybody have a wonderful weekend, and I will see most of you next week.
Okay.
All right. Bye, you guys.
Thank you.
Bye.
Thank you.